Today, let us discuss about biguanides. It is the classification of it includes in the classification of oral hypoglycemic drugs. In the second point, overcome insulin resistance. It is divided into biguanides and thiazolidine dione drugs. In biguanides, the main example is metformin. Now let us discuss about biguanides. These are also called as AMPK activator. What is AMPK? We will discuss in mechanism of action. In biguanides, there are two drugs mainly, that is fenformin and metformin. Mostly nowadays metformin is used, and this fenformin is previously used due to its production of lactic acidosis. It is banned, and now let us discuss about metformin mainly. Unlike sulfonylureas, it does not produce hypoglycemia. As we have discussed, in sulfonylureas it produces hypoglycemia as a side effect, but here metformin is not producing hypoglycemia. It is called euglycemic because these oral hypoglycemic drugs we are using oral hypoglycemic drugs for reducing the glucose level in the blood. Uh, Metformin acts as anti-hyperglycemic but does not produce hypoglycemia. So it is called euglycemic because it maintains normal glucose levels, and it does not cause insulin release, but presence of insulin is must for action. Um, we have discussed that sulfonylureas increase insulin release, but here metformin is not increasing the insulin, but presence of insulin is must for action. So from this we can know that this metformin is used for only type 2 diabetes mellitus, because in the type 2 diabetes mellitus only the pancreas will be producing some amount of insulin, like 30% of beta cells are important for this action. For presence of insulin is must for action. Okay, then mechanism of action. Metformin activate AMP dependent protein kinase. As I have told you before, that AMPK means AMP dependent protein kinase. It is one of the type of enzyme. So after the activation of AMP dependent protein kinase is do some actions, like it decreases gluconeogenesis. The ultimate aim of these drugs are to reduce glucose level in our blood. So by decreasing gluconeogenesis we can stop the production of glucose in blood. So this is one action, and the other action, it increase the peripheral uptake of glucose in tissue in presence of insulin. Only in presence of insulin, not in absence of insulin, like type 1 diabetes mellitus. In type 1 diabetes mellitus now, um, the total beta cells are destroyed, and there is no production of insulin at all. In type 2 diabetes mellitus, it will produce some insulin. So in type 2 only we can we can prescribe these drugs. And now it increases the peripheral uptake of glucose in tissues in presence of insulin. So now the skeletal muscle will also take that glucose, and fat cells also take that glucose. In skeletal muscles the glucose is used for glycogen storage, and in fat cells it decreases the lipogenesis and increases the fatty acid oxidation. This drug decreases the lipogenesis and increases fatty acid oxidation. And the other action is it decreases plasma glucagon level, and it also increases the glycolysis. The blood glucose will be utilized so that the blood glucose level will come down. So it increases the glycolysis, but only anaerobic. This AMP dependent protein kinase will reduce the cellular respiration so that ATP production will not be there. It only enhances the anaerobic glycolysis. And the last action of this protein kinase is it decrease the absorption of glucose, hexoses, amino acids, B12 from intestine. We have to remember like this because the ultimate aim is to reduce the blood glucose. One is its production is decreased here, and its uptake is enhanced, and its utilization is enhanced, and its absorption is decreased. Okay. The pharmacokinetics of metformin, these are well absorbed orally and not metabolized, excreted in urine in unchanged form. And uses, it is the drug of choice for type 2 diabetes mellitus. It also causes weight loss as the glucose in our body is decreasing, weight loss, and anti-hyperglycemia but not hypoglycemic, as I have told you before here. So it is called euglycemic. Here anti-hyperglycemic means it is reducing the HbA1c levels. The Hb glycated with the glucose, its reduction. Prevent complications of diabetes mellitus. Prevent onset of type 2 diabetes mellitus in obese middle aged with glucose tolerance impaired. In obese people it will prevent the onset of type 2 diabetes mellitus, and in middle aged persons with impaired glucose tolerance also it will be helpful. And the other action is improve ovulation. It improve ovulation in infertile patients due to polycystic ovary disease. And the adverse effects of metformin are abdominal pain, anorexia, bloating, nausea, metallic taste, mild diarrhea, vitamin B12 deficiency, lactic acidosis is rare, and hypoglycemia in overdose only. So let's repeat this: abdominal pain, anorexia, bloating. Anorexia means a lack of appetite. Bloating, nausea, metallic taste, mild diarrhea, vitamin B12 deficiency. As we have told you, it decreases the absorption of B12. Lactic acidosis, hypoglycemia. And these are contraindicated in renal failure persons, as it is excreting through urine. It If in renal failure patients we give the metformin, as it have to excrete it through urine, but the kidney failure has happened here, so the metformin will store in our body only, so metformin toxicity will occur. And in cardiac problems also we should not use this because it precipitate cardiac heart failure. In liver failure also we should not use. Alcoholics, this drug is contraindicated in renal failure, cardiac problems, liver failure, and also alcoholics. And next, in interactions, cimetidine and furosemide compete with metformin excretion. If they compete with metformin excretion, they will be lost through urine, and metformin will stay in our blood only, so it will increase the metformin levels. Then it will increase the toxicity. As the toxicity occurs, the adverse effects will enhance. That's all for today.